Hello, everyone. My name is Dr. Yonda. I'm a urologist with more than 25 years of experience. And throughout my career, I have treated thousands of men, many of them over the age of 60. Again and again, one question keeps coming back to me in the clinic. It is rarely asked out loud because many men are too embarrassed, but I can see it in their faces, in the hesitation, in the shame. The question is this: does sexual activity destroy the prostate, or does it protect it? Now, before I answer this, let me tell you why you need to subscribe to this channel. What I share with you here is not just casual advice. It is knowledge backed by medical research and decades of clinical practice. Every week, I bring you new strategies, new insights, and new truths about men's health, especially for men over 60. And, gentlemen, your prostate will be with you until the very last day of your life. If you want to keep your freedom, your dignity, and your quality of life, you need this information. So please subscribe and let us explore this vital subject together. So let us face it. For centuries, sexuality has been surrounded by myths. In many cultures, men were told that ejaculating too often weakens the body, drains energy, and shortens life. Others were told that masturbation is shameful and dangerous. Even today, I meet men who tell me they stopped having sex because they thought it was worsening their urinary problems. Some say, "Doctor, every time I have sex, I feel my prostate gets irritated." Others believe that after 60, they should stop, as if sexuality belongs only to the young. And many wives or partners also believe that sex might be dangerous for an older man's health. But what does the science say? The science is very clear. Sexual activity does not destroy the prostate. On the contrary, it protects it. Let us look at the biology first. The prostate is a small gland, about the size of a walnut, sitting just below the bladder and surrounding the urethra. Its role is to produce the fluid that nourishes and transports sperm. Every time a man ejaculates, the prostate contracts and releases its secretions. In doing so, it cleans itself. If those secretions sit inside the gland for too long without being released, they can stagnate. That stagnation can lead to inflammation, irritation, and over time, even disease. This is why modern medical research has shown again and again that regular ejaculation is not harmful. It is beneficial. One of the most famous studies was conducted at Harvard University. More than 30,000 men were followed for 2 decades. The results were striking. Men who ejaculated at least 21 times per month had a 33% lower risk of developing prostate cancer than those who ejaculated less frequently. Think about that. A one-third reduction in cancer risk just from maintaining regular sexual activity. No expensive medication, no surgery, no miracle pills. Just the body doing what it was designed to do. And Harvard is not the only one. The European Urology Journal has also published studies showing that sexual activity lowers the risk of benign prostatic hyperplasia symptoms, those frustrating problems like weak stream, difficulty starting urination, or the sensation of never fully emptying the bladder. Other research has shown that ejaculation improves pelvic circulation, increases oxygenation, and helps reduce inflammation markers in the body. Now, let us address the other side. Are there situations where sex could harm the prostate? Yes, but only in very specific conditions. For example, if a man already has an active prostate infection, known as prostatitis, ejaculation during that period can be painful and may worsen symptoms temporarily. If a man engages in risky, unprotected sex and contracts sexually transmitted infections, that too can lead to prostate complications. And finally, if sex is forced, done under stress, or accompanied by guilt, it can create more tension than benefit. But these are exceptions. In a healthy man, regular sexual activity is not dangerous. Now, let me share a story from my clinic. A man of 68 came to me with complaints of frequent urination, waking up 4 or 5 times every night. He told me, with shame, that he had stopped all sexual activity years earlier because he believed it was the reason his prostate was getting larger. He thought abstinence was protecting him, but in reality, it was harming him. I explained the Harvard study to him. I told him about the cleansing mechanism of ejaculation. I reassured him that masturbation is not harmful, that it is in fact protective. He listened carefully and slowly. He began to reintroduce regular sexual activity into his life. 3 months later, when he returned for a follow up, his symptoms were noticeably improved. He was sleeping better, less anxious, and even his mood had changed. His wife came with him and told me she felt like she had her husband back. That is the power of understanding the truth. Sexual activity helps the prostate in several ways. First, it flushes out toxins, dead cells, and stagnant fluid. Second, it improves blood flow to the pelvic area, which nourishes the gland. Third, it relaxes the muscles around the prostate and bladder, making urination easier. Fourth, it reduces stress. Stress is a silent enemy of the prostate. High stress produces cortisol, which weakens immunity, lowers testosterone, and fuels inflammation. Ejaculation reduces stress by releasing endorphins, serotonin, and oxytocin, the very chemicals that improve mood and relaxation. And finally, regular sex boosts intimacy, connection, and mental health, all of which indirectly support physical health. But let us talk about masturbation, because many older men feel guilty about it. They think it is shameful, childish, or harmful. Let me tell you very clearly, the prostate does not care whether ejaculation happens with a partner or by yourself. The biological effect is the same. The Harvard researchers did not distinguish between partner sex and masturbation. What mattered was the frequency of ejaculation. Whether you are married, widowed, divorced, or single, you can still protect your prostate by maintaining regular ejaculation. It is not dirty. It is not shameful. It is medicine. Some of you may be asking, is there such a thing as too much sex? Can the prostate be worn out by frequent activity? The answer, based on science, is no. There is no evidence that frequent ejaculation damages the gland. The prostate is designed for this. Of course, common sense applies. If you are exhausted, dehydrated, or ill, forcing yourself is not wise. But in general, there is no upper limit that science has found. What harms the prostate is not activity. It is inactivity, stagnation, and silence. Let me give you more data. The International Journal of Cancer published research showing that men who included more sexual activity in their lifestyle had significantly fewer cases of aggressive prostate cancer. Another study from Australia confirmed similar results. The pattern is consistent worldwide. The conclusion is simple: regular ejaculation protects. Now, what about men who already have prostate enlargement? Also called benign prostatic hyperplasia, or BPH. Can sex worsen their symptoms? In most cases, the answer is no. In fact, for many men with BPH, regular ejaculation actually relieves discomfort. The contraction of the gland during ejaculation can help reduce congestion and pressure. Some men even notice that their urinary flow is slightly better after sex. Of course, if you experience pain or burning, consult your doctor. But for the majority, it is beneficial. Sex also has indirect benefits. When a man maintains intimacy, whether through sex or self-pleasure, he maintains hormone balance. Testosterone levels, mood, and sleep all improve. And we know that sleep is a critical factor in prostate health. Poor sleep doubles the risk of aggressive prostate cancer. But sexual activity helps you sleep better, relax deeper, and wake up more refreshed. Now I want you to imagine two men, both aged 70. The first believes that sex is dangerous. He stops all activity. His prostate fluid stagnates, his circulation weakens, his stress builds. He begins to have urinary problems, his mood declines, and his quality of life drops. The second man at the same age maintains a regular sex life, even if modest. He ejaculates regularly, alone or with his partner. His prostate stays cleaner, his stress is lower, his sleep is better, and his risk of cancer is lower. Which life would you rather choose? Gentlemen, the evidence is clear. Sexual activity does not destroy the prostate. It protects it. The science is unanimous. What destroys the prostate is the absence of activity, the weight of myths, the fear, the shame, and the neglect. If you are over 60, you must understand this truth. Do not be afraid of your sexuality. Do not let old superstitions rob you of your health. Whether with your partner or by yourself, make ejaculation a regular part of your life. It is not just pleasure, it is medicine, natural medicine for your prostate. And once again, I invite you to subscribe to this channel, because week after week, I will bring you more truths about your health, more strategies, and more answers to questions you may have been too embarrassed to ask. Your prostate will accompany you until your last breath. Treat it well today, and it will serve you tomorrow.